Hi, I'm Dr. Stephen Olmos, and today we're going to talk about CPAP alternatives. I'm board certified in pain and sleep. This is our facility here in La Mesa, and what a great team, fantastic group of people. Um, I have established protocols that are used all over the world. These are our 65 centers dispersed over 7 countries, and these docs have been personally mentored in these techniques by me. So let's talk about treatment alternatives to CPAP. Positive pressure is one treatment for obstructive sleep apnea. Surgery, as you can see, the palate being removed here. Diet and exercise are good treatments as well. In fact, the two biggest potential problems with treating airways is if a person has nasal obstruction or they're overweight. So those are two key factors we need to look at. There's also a technique called hypoglossal nerve stimulation, and this is where a device is inserted in your chest to move your tongue forward every time you stop breathing. There's oral appliances, as demonstrated here, and there's also combination therapies where we can avert having to have straps on the head and this sort of problem. So let's talk about surgery for a second. Well, if you look at most of the surgeries that are done for the problem of obstructive sleep apnea, they don't have a very good outcome. About 70% of the time they fail. Now, most times when you go to get a sleep study, whether it be in person at a facility or attended by a nurse or at home, you are diagnosed with how many times you stop breathing or your oxygen drops. But rarely is there examination of exactly where the obstruction is. This chart right here, this diagram is showing you that there's 4 points of obstruction. Nasal valve, the first point of entry, can be blocked. The nasal area and the soft tissue and bony confines could be obstructed. The velopharynx, right there by the soft palate, number 3. 81% of the time, obstructive sleep apnea, that's where it's obstructed, or at the base of the tongue. So the treatments are traditionally positive pressure, so that's CPAP, BiPAP, APAP. But the problems is that most people don't use these. In this paper here, an estimated 46 to 83% of the patients were non-adherent to CPAP when compliance is defined as usage of 4 hours or greater. So if it's 4 hours is certainly not enough sleep for anyone. But that's considered a success. And even at that, most people don't use it. So why? Because of the irritations, the leaking of the air into the eyes, out the mouth, abrasions to the nose, imprints on the face. And that's why there's so many different types of masks. I think very often the reason why the strive to find a comfortable mask is very often because of the nasal obstructions that haven't been diagnosed. And that's one of the things we do is we take an x-ray of the head before we treat anyone so that we know where the obstructions are. So you see the problem across the board here is the seals. So if you're trying to blow air up the nose but it's blocked, well, the air has to go somewhere. And that's where you'll see these leaks. So the air is going into your eyes, it's coming out your mouth. So the object is to get tighter fit, mask over your eyes so the air doesn't blow in, chin mask to keep your mouth closed. Well, the problem with that is then that can produce TMJ problems. So then the idea is to tighten it down further and further, causing lacerations to the nose. Something as simple as a breathe right strip has been demonstrated to really improve CPAP function. If number 1 on that chart, which is the nasal valve, if that's blocked, then you're not going to be able to apply air into the nose. So with a simple breathe right strip, open that up. These studies have shown to be very effective. So what's the difference with alternatives between an oral appliance and CPAP? And this is a paper that went head-to-head with the same population group to discern the differences. And in this paper, the dotted line is the CPAP efficacy and the solid line is the oral appliance. Now, CPAP was better at treating the problem, but if no one uses it, that's the issue. When it comes to symptom control, they're equal. Health benefits, the same. Adherence is much better for oral appliances, as well as tolerance and patient partner acceptance. Convenience is certainly greater with an oral appliance than a CPAP, and the affordability was about the same. Oral appliances come in different shapes and sizes with different types of connecting pieces, either elastic or screws or printed type varieties. And they look different in terms of the acrylic techniques or printed versions. Today, we use scanning so that we don't have to take impressions of people's mouths with the gagging and this sort of thing that people have issue with. And we produce a three-dimensional model that is held at a particular place to keep the airway open. And this is transferred to models for which the appliances are made. Now, the actual technique that we use is different. I published the technique, the Seligman phenome registration in Sleep and Breathing back in 2007, of a technique that's the three-dimensional positioning so we don't jut the jaw out. And we published this paper talking about the relationship. You'll see the lower teeth in blue there, where the lower jaw is not jutting forward. The traditional technique that most dentists use is jut the jaw forward, but this can produce problems with the jaw. And so in the paper that we published last year, we did a head-to-head and found out that our technique was equally as efficacious as the George gauge, but didn't protrude the jaw, so we have less issues on that aspect, and even have less titrations in our study, which means movement forward. Okay, so there's oral appliances, there's CPAP, surgery, but what if there's severe apnea? In some cases, the CPAP by itself isn't effective, so it has to be combined with something else. In this technique, we call it a hybrid, where we have a printed device that's connected to the nasal delivery of the CPAP, and this benefits in many different ways, because the oral appliance is holding the airway open, so it requires less air, so that with titrations can be reduced. That's one of the big complaints people have, is the pressure's too high. And this is allowed to now just have two nasal delivery as opposed to a mask, which is claustrophobic. And there's no straps. As you can see, the device itself holds the nasal delivery in place. And that's just more comfortable because there's a lot of people who have issue on that. What about patients who snore or have very mild apnea? There's techniques to treat the tissue in the throat and the tongue to stiffen it up so that it's less floppy, so reducing snoring by 50% on the first treatment. Here's a little video from the manufacturer of the laser system that we use to help better explain. So I hope this answered some of your questions about alternatives to CPAP. Everyone is an individual case, but we've got a myriad of different techniques that can be successful in making sure that you have a good night's sleep.